All right, y'all. So today we are doing our nursing pictures for class. And as you can see, I had to get kind of cute, the lighting ain't all that great, but whatever. But yeah, so we doing pictures today. I just got here. My appointment is at 4. So I got like a couple minutes. So I just want to talk to you guys before I walk in there and take my pictures. But anyway, so that's pretty much what's going on. So we're taking pictures, and then we can of course write a check to buy our photos, and when graduation comes, I'm sure we'll have it, or probably before graduation. I'm not sure. It was in directions and all that stuff. I didn't read it, so I'm gonna go ahead and do that, and then once I leave out of there, then I will check in with you guys. But before we go into the campus, we have to do a Helpfully. It's like a Helpfully app. It's called Helpfully, whatever. But we have to fill that out before we can enter the campus. So I already did that. So I'm gonna go in there, take these pictures, get up out of there, and go home. I need to study because we do have a respiratory test coming up. And I am trying to get a really good grade on that, but the teacher is super confusing. Like, we'll talk about it when I get back in the car. But yeah, so I just wanted to touch base with you guys before I walk into there. I got to put on my mask. Hopefully it don't mess up my little makeup that I attempted to do today. But yeah, so I'll check in with you guys on the way out from taking pictures. Okay guys, so I was the last student to go, so that was really quick. Like, nobody was in there but us, because we had to do time slots, and I completely forgot to do a time slot. Like, I didn't even know we had to sign up, but she had sent the email out like a couple of days ago, I think Friday, and she was like, hey, you didn't sign up. Were you going to take photos? Did you want to get photos done? And I was just like, oh crap, I didn't know we had to sign up. But anyways, so I just let her know, she let me know what time was available, and I was like, cool, I'll just take that time, which was like 4 o'clock. But he literally snapped, like every picture he took was bomb. Like, my makeup must have been really bomb today, because he even let me look at my photos, because I'm like, this dude lying to me. Like, I was like, you look all right? Because I felt like I was fake smiling, because I didn't want to show like my gap. So I was like fake smiling or whatever, and he was like, hey, come on, come and look. I don't let nobody look, but you can look. And I look. When I say them photos were so beautiful, I was like, model chick. Okay. But anyways, so yeah, I'm walking to my car now. That took like 5 minutes. Like, I'm not even joking. But yeah, so let me tell y'all about this dang on respiratory teacher. Okay, let me get out of tea. Whew. So before I start driving, okay, so we are doing respiratory. Our test is next Friday, right? Whew. Okay, so basically he's like, everything you need to know is on my PowerPoints, and what do you say? PowerPoint, and like he posted like certain like boxes and stuff from like the textbook. The problem is his textbook is outdated, if I'm not mistaken, or either his is newer. No, his is outdated, and it does not. Some of the information that he posted does not match the information in our book. So of course, in one of the classes, I did ask him, I'm like, because I was reading about suctioning a trach patient, and to my understanding, you're not supposed to go, insert the catheter until you meet resistance. Like, you're not supposed to do that. But on his thing, it says until they cough or you meet resistance. Like, you're supposed to advance it until you meet resistance. So I'm like, that's contradicting each other. And of course, there's some other things that contradict each other, and other students was bringing it up, and he does not like to be corrected. So I don't know how this test is going to go, because some of his information don't match, but he's like, oh, read the book. But he's like, but go by what I put. And I'm like, so which one is it though? Like, you telling us to look through the book. He's like, if I didn't talk about it, then it's not testable. Okay, great. But what you do talk about, we find contradicting information in the book, which he do tell us to refer to the book sometimes. But it's like, so should I just not refer to the book at all and just literally go by your PowerPoints? Because that's how I kind of feel right now. I got indigestion or something. But that's kind of how I feel right now. You know what I'm saying? Like, it's so confusing. And it's like, dang, what if I get a test question and I get it wrong? And he'd be like, oh, well, that was in the book. And like, okay, when you made it clear, like today in class, he was like, well, you know, go by my PowerPoints and go what I have posted, you know, the pictures and whatever I have posted. Focus on these things. Okay, great. But he also was like, okay, this is how you go through the book and just go through the stuff I talked about. Like, what? Like, our book is not matching your information. So now I'm confused because in my book, it says this, but your lecture says this. So, yeah, honestly, I felt like he was like straight to the point. But then once we got deeper into learning about respiratory and things like that, and just going through his PowerPoints and him doing the live lecture and us, you know, kind of looking in the book of what he told us to look at, and it's not adding up, and it's kind of scary. It's kind of to the point where I'm like, I really don't know, you know what I'm saying? Like, if this is on a test, then what if I go with what the book say, but he say go with what he say? Because ultimately the test points are the teacher's doing. So he's the one that decides all of that. You know what I'm saying? So he decided if he's going to give points back or not give points back. And he's just really confusing right now. So I guess we'll just have to wait and see. I'm going to study. I'm going to do like some flashcards and stuff. But respiratory, really, you want to pick the respiratory answer. I get that. But some stuff you really need to know, specific interventions in nurse management. I don't know, and testing and diagnostic testing and stuff. But I just feel like it's contradicting, you know what I'm saying, in a way. Like we talked about TB, tuberculosis. Like, you need, I think it's like 2 negative sputum cultures to be considered not positive for TB. In the book, it says 3. And then on his PowerPoint, which he did like a question and answer type of thing, like, you know, where we had to pick or whatever, a question, and it said 1. So I'm like, which one is it? But in that case, he was like, oh, okay, yeah, I think he said it's 2 or 3. I'm gonna go back and listen, because I'm just like, okay, dude, like, your PowerPoints and stuff, like, I don't know, y'all. Like, we gonna see. Like, I want to get a really good grade, and I've been doing pretty good with like my ATI testing and just doing practice questions. I've been doing pretty good with practice questions, but I don't know, it's just like, I can't explain it. But if you've ever had a teacher like that, then you know what I mean. And he already let us know he's gonna have like 7 to 12 select all apply questions. Like, he already let us know he's gonna have like 3 math questions. He gonna have this and that. And it's kind of just like, dang, okay. One, I do not like select all apply questions. I'm not going to lie. Like, I do not like those things. And hopefully he's not really tricky with the words, like with the wording or whatever. I don't know. I guess we just gonna have to find out and see. I'm definitely gonna let you guys know what's been up with that. So I really don't know. But anyways, yeah, I'm finna go ahead and head home. Traffic is finna be absolutely crazy out here because it is like after 4 o'clock, and our traffic is from like 4 to 6 ish. So it's gonna be like packed and backed up on this highway. So I'm finna go ahead and head home. But yeah, so I don't know. It's like, I feel like I've been studying, but then I also feel like I haven't been studying enough. Like, maybe I'm just getting too, like, maybe I'm too relaxed. Like, I don't know. Like, I'm just not feeling it. I don't know what it is, but I'm gonna study today. I do have clinicals in the morning. Hopefully I get to go to the cath lab or either to ICU, because I've been thinking about ICU. I haven't been to ICU, but I want to see what it's about. But that just became an option for us to do at clinicals. This one girl went last week, so hopefully I'll get to go tomorrow. If not, hopefully the cath lab. That would be like super interesting, because I've been there once and I absolutely loved it, but we shall see. So I don't know, but anyways, y'all, so I do have a TikTok now. Yes, I got addicted to freaking TikTok. At Facesbf Frankie 1, so it's just the number 1. So you guys definitely should follow me on there, because I ain't really got no followers, and so follow me. I'm so lame. But yeah, so I'm gonna go ahead and head home, and then I'll check in with you guys once I get home. I don't know, but I need to study, because I feel like his test is about to be some BS. That's just how I feel. So I'm just gonna go by what he say. I'm just gonna mainly go by his PowerPoints and by the little charts and graphs or whatever little boxes he be posting, and just kind of go by that. And hopefully that's enough, and I get my questions right. But once again, we don't know how he write his questions. He do tend to pull questions from like ATI and stuff, so hopefully his questions are on a similar writing style as ATI. But we will see. Yeah, I was gonna record when I got in there, but honestly, it was in a small simulation room, and the teacher was like right there at the door. She wanted to see the Helpfully app, just to see that you filled it out and that you don't have COVID. And then after that, they wanted you to fill out your envelope to put put a check in there or write your credit card number information, and you just go straight in there, sit down, and take your picture. Like I said, I was in there for literally 5 minutes, and dude was done. He took about 4 pictures, and he was like, I like all 4. Let me see. I didn't say that, but I was like, you sure? Should I redo it? But he let me see it, and those pictures was bomb. Like I said, walking to the car, I was like, okay, model girl, okay, sis looking real cute today. Anyways, let me go. I will check you guys when I get home. All right, guys, so I finished clinicals today. I'm actually at the park. I brought my kids to the park for a little bit, just to get some fresh air and get out the house before I start studying. So maybe on the swing. Let's see, it's pretty empty on the park it's 3 different separate little parks, playgrounds, and it's packed at the other 2. So we just came to this one because, honey, I'm exhausted. So basic clinicals was cool. I got to go to the ICU today and work as an ICU nurse, and it was actually pretty fun. Our critical patient was really critical, intubated. We did a not an NG tube, but a some tube. It goes down your mouth instead of your nose. My patient was on a ton of sedative medications. He was in restraints. He was very, very combative. Shockingly, he was very combative. So we went to turn him to kind of straighten him up and stuff. He got really, really violent, even though he wasn't even cognitively there. He was very, very combative. So we had to up the fentanyl and stuff just to get him pretty sedated. For us to do, we drew blood today from him. We did a CVP, and that just measures the venous pressure of the right atrium, so we had to do that test on him. He also had a echocardiogram, which, you know, basically just looks at the heart, like kind of like an x-ray of the heart, but it's like a sonogram, or I don't know, an ultrasound or something like that. It was pretty cool to see them do that. So we did a lot of stuff with him today. He was very, very critical. My nurse had 3 patients, but the other 2, one was going to be discharged and the other one was just not really critical care. So the main one was the one I'm talking about, was the most critical care out of them. And it's crazy because he was so combative. We're trying to like hold him down, like stop him, because when he was like combative, he was like trying to pull out his tubes and everything. Like he was going crazy, even though he wasn't even like aware. And it's crazy because right in the middle of us trying to like hold him down and stop him from doing all of that, because, you know, we had to take the restraints, unloosen the restraints just so we can pull him up in bed, because we was trying to readjust him. But yeah, in the middle of that, it was crazy because his wife just happens to pop up. Mind you, no one has been there to see him for like almost 2 days. So it was just kind of shocking. The lady like standing at the door, and we're like, the nurse like, yes, how can I help you? And she's like, oh, I'm here to see whatever. And we was like, oh crap. Like, I think they were supposed to call. She was like, I don't know why they didn't call before they sent anyone up, but nobody called. So she just kind of got to see some things. So she's like, okay. So she left and came back or whatever. But yeah, so that was pretty interesting. I did like the ICU to a certain extent. That hospital is actually pretty cool. I gotta push her on the swing. Actually pretty cool. I like their setup and everything. I think their setup is pretty cool. But y'all, to be honest, I don't think they hire black nurses. I have not seen not one black nurse, and I'm not even exaggerating. So I know my clinical instructor, she's the charge nurse on like one of the step down units, the ICU like step down unit, and like the only black nurses, which are students, which is me and another girl in my class. And the other student asked her like, hey, do y'all hire black nurses? And she was like, yeah, we have black nurses, none on this floor. And I'm like, okay. So when I went down to the cath lab, I didn't see no black nurses. I went to ICU, I didn't see no black nurses. And I'm like, that's about 3 departments I done been to, and I ain't seen no black nurses. So I asked, so one of the nurses like, oh, you should definitely work here. You should apply here, da da da. I can tell you who's the manager that's hiring, da da da. You heard information. I was like, look, I'm not trying to be funny, but do y'all hire black nurses? And she's like, oh yeah, we have some on night shift. Like, she sounded very unsure, and I doubt that they have some on night shift, but they probably hire a certain number of black nurses, but not many. So dang, Kamara, you okay?
Yeah.
About to get knocked out by the swing. So I don't think that they really hire black nurses. I'm not trying to say they racist, but I am trying to say they don't really hire black nurses or doctors. I ain't seen no damn black doctor. Yes.
Race with me.
Hold on, baby. So I don't know, maybe it's just the day we go there's none, but yeah, I haven't seen any in like no departments. The only time I seen a black phlebotomist, and then I seen a black guy that did the like supply, like bring up the supplies that the nurses needed, but I haven't seen like black nurses or doctors. So, but I like the hospital, but that just kind of makes me think like, why am I not seeing people of color? But anyways, but other than that, my day was a wonderful. I just wanted to vlog with you guys, let you guys know it was wonderful. I am gonna study for today, and then that's gonna be about it. So I just wanted to wrap up this vlog. I hope you guys enjoyed it, and yeah, so I'll see you guys in the next vlog. Don't forget to subscribe, comment, share, give this video a big thumbs up, and I'll see you guys in the next video. Peace.